Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is how spinal decompression therapy works so well. The evolution of spinal decompression therapy. Spinal traction has often been used for back pain and pinched nerve conditions, but research has not backed it up, though, for the lumbar spine over the years. In the late 1990s, spinal decompression therapy became FDA cleared, which is different than straight lumbar traction. Favorable research studies and intense marketing have exponentially increased spinal decompression therapy's popularity. Why is decompression different than traditional lumbar traction? Well, continuous traction leads to spasms and guarding of the low back, and research just doesn't support it. Now, it does support it for the cervical spine with over-the-door traction or options like that, but not for the low back. Spinal decompression offers intermittent spinal traction that basically fools the spine into avoiding spasms and guarding, and multiple studies are supportive of what it does. Spinal decompression therapy, as you can see here in this animation, distracts the vertebrae, okay? So it distracts the vertebrae and it creates a negative pressure that pulls in blood pressure, oxygen, and therefore nutrients. All right, let's see that again. It decompresses, distracts the vertebrae, and it therefore pulls in blood flow and nutrients and oxygen. So it's non-invasive, minimal risk, 20 sessions approximately over about a 7-week period that lasts 30 to 60 minutes. Typically it's painless. A lot of people fall asleep during the treatment. It's computerized. Tables can range from $5,000 up to something like this DRX, which is $100,000. I can tell you right now from personal experience, they are basically the same effectiveness as long as the computerization is the same settings. Here's the indications. If you have a herniated or bulging disc, it can be very effective. Degenerative disc disease, spinal stenosis, facet syndrome, failed back surgery syndrome, and then both neck or back issues are handled well with the decompression therapy. There are some contraindications. For those who are pregnant, it's contraindicated. If you have severe osteoporosis, it's contraindicated. And if you have a spinal fusion, it's okay, but if you have instrumentation with screws and rods, it's also contraindicated. Outcomes. A study in the American Journal of Pain Management showed that 86% of ruptured intervertebral disc patients achieved good to excellent results with decompression. For sciatica, 75% have obtained good to excellent results with spinal decompression. So 75 to 86%. There was another study in 2003, over 200 patients, 86% completed the treatment and reported immediate resolution of their symptoms, while 84% remained pain-free for 3 months after treatment. Physical exam findings showed improvement in over 90% of the patients and remained intact in almost 90% of the patients 3 months after treatment. So both of these studies have shown tremendously satisfactory results. What's the cost? Well, some insurance companies cover it now. Most actually don't. So a lot of it is self-pay. And it's going to cost anywhere from $1,000 to $3,000 and up for the series of treatments. It's dropped dramatically from where it was 10 years ago. Much more affordable, and it costs less than like 5% that of what spinal surgery costs. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The board-certified award-winning doctors and chiropractors average over a 90% success rate. Visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.